What has been found is that there are certain proteins which are associated with Alzheimer's disease that are altered in the cerebrospinal fluid in a way that you do not see alterations in the blood. So you get a unique signature that reflects the biology of the disease, Alzheimer's disease.
And so by looking at these biochemical changes or biomarkers, we can get an idea of disease processes that are occurring long before we can detect them symptomatically, before any changes in behavior or any changes in the symptomatic effects of the disease occur, before any memory loss.
So an ideal test would be a test that would tell us if a patient has this Alzheimer's before all the signs and symptoms start appearing. And currently there's research available that shows that lumbar puncture, spinal tap, that we can take this cerebrospinal fluid and check it and see if there is the proteins that we see in patients that have Alzheimer's.
The spinal fluid donation is a calm and peaceful contribution to our future research needs.
So what Dr. Hack is doing now is he's feeling down the spine to find a portion of the lower back where there's just a small cup of fluid. The spinal cord ends several inches above it, and that fluid just sits there. Once Dr. Hack finds the spot, he'll begin the procedure, which is quick and easy, like a standard blood draw. Having found the spot in the space between the two bones, Dr. Hack will clean my lower back with a little bit of iodine, being very careful not to get any on my clothes, as it does stain permanently, and I'd hate to ruin my white shirt. Cleaning the back prevents infection, tracking along the needle insertion site. Of course, anytime we put a needle through the skin, a standard blood draw, or a spinal fluid collection, you do run a risk of a superficial infection. This risk is extremely low. Feels a little cool, but refreshing. Dr. Hack has put on sterile gloves at this point and is just rechecking the site before he gives me a little bit of lidocaine, that's like Novocaine at the dentist, to numb the area where the needle will be inserted. Just like at the dentist office, you feel a little pinch and burn with the initial injection of the Novocaine. There are very few sensory endings in the lower back. It's an area that is naturally numb to begin with. Dr. Hack is applying a little bit more Novocaine to the lower back area, using a slightly larger needle to get deeper next to the bones of the lower spine. I feel a slight amount of pressure, but actually I can't even tell that the needle's entering the lower back area. Dr. Hack now prepares to draw the spinal fluid with a longer needle that'll fit through the space between two of the bones of the lower spine, again into that small cup of fluid that holds the spinal fluid in the lower back, well below the spinal cord in a very safe area. Again, the lower back is completely numb at this point. I did not even feel the needle insert between the spine. The spinal fluid is under extremely low pressure. It should look clear like spring water, and it should drip drop by drop into the collection tube. This spinal fluid is extremely precious for our research in Alzheimer's and other degenerative brain disorders. The procedure was a piece of cake this morning, and in the majority of cases, it runs as smoothly and efficiently as a standard blood draw.
Most patients have had their blood drawn, and I tell them that the discomfort and the tolerability is about twice as much as getting blood draw. It's very fast, and all the patients that I've done spinal taps on have tolerated the procedure very well.
After the spinal fluid procedure is complete, we do see a small number of subjects that may develop a low-level headache, a feeling of pressure in the head from removal of the spinal fluid. This headache typically resolves within just a few hours.
We have a technique for readily reversing that problem should it occur, even though it's fairly uncommon for it to occur.
Often, a simple cup of coffee is sufficient to restore the spinal fluid levels and eliminate the headache.
It's very safe. This is a procedure that's done in the ER on a daily basis, even as we speak. Some physician in the emergency room is probably performing this procedure. It's used to diagnose infections, fevers. If somebody comes in with fever and we don't know what's causing the fever, we can use this procedure to diagnose this. It's a simple procedure that has been done over and over and over.
We are out to cure Alzheimer's disease, and we're out to cure Alzheimer's disease by prevention. So it's as a research tool, we think this has tremendous potential for future treatment and cure of Alzheimer's disease.